welcome to another episode of The Drill. I am Ryan Dunn, CEO at the Virginia Dental Association, and we take this opportunity every month to bring you just some of the highlights and some of the goings-on here at the Virginia Dental Association so you can know what we're up to. Today, I am happy to have Paul Logan, our Director of Strategic Initiatives, here joining us. How you doing, Paul?
I'm doing well. How are you, Ryan?
I'm great on this windy day, but happy to see the sun shining. So if you have tuned in to this before, we try to follow our 3 areas of focus that our strategic plan lays out. This one, we are going to very much only focus on our advocacy. As we look forward to 2026 and the General Assembly is only a few short weeks away from starting, we thought this would be a great opportunity to really focus on our 3-legged stool for our legislative approach. And Paul has been focused on workforce. That has been the initiative, if you will, that you have strategically been focused on for multiple years, Paul. And it is one that it's complicated, isn't it? It's not something that we can solve with one bill or one regulation or one budget item or anything. It is very much a complicated issue as to how we got here and to also how we're going to get out of it. So with that, the leadership at the VDA, the Council on Government Affairs, and the Board of Directors at the VDA, all of which have been directed with the policies set by the Virginia Dental Association's House of Delegates. And so this has been a long process to get here, but we have a 3-legged stool is what we're kind of dubbing it for this upcoming session. We are going to be focused on 3 parts. One, we're going to focus on the old adage of more money can fix the problem. We will be advocating for some budget increases, right? And that's smart for us to do. There has been a lack of investment when it comes to workforce, specifically dental hygienists and the programs across the Commonwealth. So that is likely to be tough this year, isn't it?
Well, yeah, I mean, it is shaping up to be a challenging budget year. But as you said, the investment is needed if we're going to increase seats in these programs. We had a JLARC report come out this fall, identified dental hygiene programs as the most expensive per credit hour program that is operated through the Virginia Community College system. Now, the other side of that is they're also graduating the highest paid positions that come out with a 2-year degree from the community college system. We've been having conversations with Chancellor DeRay, others, about how can we adjust or even create a funding formula as right now, they're not charging differential tuition that recognizes those high demand career options that the education programs have extensive wait lists throughout Virginia. That's something we hope to address. That's not going to solve your problem next year or the year after, but it is something that we have been engaged on, focused on to try to address that bottleneck. Because the fact of the matter is today you have a lot of people working in dental practices, whether it's a dental assistant, a dentist who was educated internationally, who want to be doing more, but don't have an educational pathway to do that.
Yeah, I mean, we have waiting lists beyond waiting lists. We have people who are going well outside of their community to go find what, to be quite frank, should be something that is trained and licensed locally. And that is one of the unique things that the community college system usually has great luck in doing, which is training the people locally who are going to stay in the community. But when you have no program inside of the greater Richmond area, inside of the community college system, that leaves those folks who are interested in getting a hygiene degree to go to Wytheville or to move outside of the region. And do they come back? Maybe, maybe not. So it is something we will be advocating for. Specifically, there's some budget money for long-term funding that we will be focused on. Even some individual programs like down at the Peninsula Community College, they are seeking funding to get their program back up and running and to have some money to sustain that over a long period of time.
That's right. And another thing that they are doing at the community college level is considering how can we better share resources to help mitigate some of those high costs, and how can we open with larger class sizes that take advantage of some of the just economies of scale. It's a very hard thing to do to educate 5 or 10 students in a class and not have just a lot of inefficiencies that you would gain by having larger class sizes, sharing didactic education between more programs.
That's right. We've got to definitely be more creative in how we bring down the costs for what is a costly, like you said, program, but one that is super vital and important, obviously, to the overall health of Virginia. So that will be a big part of our General Assembly. The governor just released his budget, and there will be a new governor coming in, a new General Assembly coming in. They have to rectify their wishes versus the outgoing governor. It's pretty much the lame duck budget that he is putting forward. But it is it's a challenge. There's always new priorities for how money is being spent. So we will be advocating hard for that as well. So, but a tough year for budget money and for budget asks every year. I feel like that's the MO down there. But the second leg of our stool is going to be expedited path for licensure to practice hygiene for internationally trained dentists. This is something that has gone through some vetting, has been talked about at the Board of Dentistry, although no recommendations were made to do anything about it. That's where we will take the ball and run with it. This is something that has been expressed to us from others and from people at the Board of Dentistry that there are people calling, asking and inquiring about this that are already in Virginia. And to be quite frank, my dentist even has an internationally trained dentist that is anxiously awaiting this type of legislation because they don't want to go back to dental school here in America, but they do very much want to be able to practice hygiene, which this would allow them an expedited path. They still have to go through all the licensure and stuff, right? So, what are your thoughts on that?
Sure. So, and this is something, as you said, been done for many, many years. And in Florida, Vermont, most recently, has now created this pathway through regulations, not through legislation, to create a pathway for an internationally educated dentist to practice hygiene. Another group we've heard from has been legislators have reached out and are independently interested in how can we better utilize the workforce that we have here in Virginia today to be able to provide additional preventative care. So as you said, this is a bill that the Board of Dentistry hosted a work group meeting this August, went through the ins and outs of what are the appropriate parameters to ensure that patients are protected, that the licensees have appropriate experience and education before taking the same clinical licensure exam that a dental hygienist who goes through a CODA accredited program would take. And the legislation, importantly, also provides some discretion to the Board of Dentistry so they can evaluate the credentials of this internationally educated provider and say, these credentials are equivalent and they have the credentials, experience to be able to do this, or these credentials are not sufficient. Right. And so that they are not going to be a candidate for licensure. But as you said, we have many who are currently practicing in other roles in dental practices today who are very interested in that position. CODA this past year has changed their rules for faculty members to allow internationally educated dentists or hygienists who can become licensed in that state to serve as faculty members in accredited programs. So not only could this potentially have an impact in private practices, but this can also potentially be a piece of addressing the challenges that many education programs are having in terms of recruitment for faculty.
Sure. Absolutely. And we know that this is a cog in the wheel, right? This is another item. This goes back to what we talked about when we first started. There is no silver bullet when it comes to fixing workforce. You have to look at all options, all things that make small differences. And we actually think there are more than we even imagine who are out there willing to do this expedited path. So that is exciting. And it's a very reasonable approach. But I'm going to go to our third leg of the stool, which is probably, well, not probably, is definitely going to be the most contentious in the General Assembly. I don't really think it should be, as I think, from my perspective and the amount of time and effort that has been put into this to account for everyone inside of the dental team, including dental hygiene, this is a very measured approach. And this is to add a preventative assistant to the dental team, meaning an expanded function dental assistant, a dental assistant who, after completing the criteria of hours and training, is certified by the dentist to have completed those things, and then will be allowed to supergingially scale on healthy teeth. That's pretty much it, right, Paul?
That's it. And
it's pretty simple. Yes. It is complicated because it's a change for what a dental assistant can do, but it's pretty measured. This is a small move, but yet has the ability to really impact the delivery of care and the access to care problem that we're seeing, right?
That's right. And something important to understand is this is not a new idea. Mm-hmm. This has been part of ADA policy since the 1990s. This has been part of VDA policy for the last 20 years.
And actually, the VDA supported when they created the Dental Assistant 2 program, which some listening to this may not even realize that Virginia has a DA2 because there's only 30-some odd ones in the state, I believe, maybe a few more. But when the DA2 was created, scaling healthy teeth, supergingivally scaling, was going to be part of it. But that was removed during the creation of that in the General Assembly.
No, that's right. That went through a regulatory process. The Board of Dentistry ultimately declined to include supergingival scaling within the scope of the DA2. And DA2s is an important role that the practices that employ them have found to be very helpful as far as working into the flow of patient care. The DA2 in Virginia today is permitted to do several tests that otherwise are reserved for dentists. What we are proposing with this scaling assistant is to allow assistants to be incorporated into that hygiene appointment, to take some of the least invasive part of that hygiene appointment and assist the hygienist who, as all of our members know, there are a lot of burnout dentists. There are a lot of burnt out hygienists today in Virginia who want to be able to say yes when patients call and want a timely appointment for preventative care, want to see them before a problem becomes worse, but just don't have that ability because they aren't permitted.
That's right. And so the unique part of this is that you will be able to get your certification to do this as a DA or a DA2 to become a preventative assistant, meaning allowing to scale. You will be able to receive that training and certification by the dentist in the dental office. This is honestly something that is not uncommon to healthcare. You see this as earn while you learn, learning on the job type of thing when it comes to nursing. And like I said, I like to use the word measured because it is a measured approach. We did not take an axe to this policy. This was very much a scalpel. We have small change that has the ability to open up the whole entire scope of work, from the dentist, allowing them to get out of the business of scaling and allow them to practice at the top of their license, and then hygienists to practice at the top of their license, let them focus on more advanced issues and problems, root planing, you name it, whatever it may be, and allow a healthy person's mouth, which is determined by the dentist, to be scaled by someone who has been trained in the office by the dentist.
And that in-office piece is important. It's something we heard from our members. We put out a member survey this past March asking our members about various workforce models. Ask them, would you consider hiring someone in this role in your own practice? And for both internationally educated dentists and dental assistants being permitted limited scaling, the overwhelming response, more than 80% of our members, was yes, I would.
Right.
And one of the things they told us in the verbatim feedback was we heard from many practices that I have a rock star dental assistant in my practice today who wants to be doing more, but we either don't have a local education program and they can't take time off work and away from family to go pursue that education, or they have applied to programs, but there is a huge wait list.
Sure.
And they're considering going into another profession because they are a rock star and they are going to grow.
This is upward mobility, right?
And this provides the opportunity for that intermediary role that they can get that education in the practice. And I would expect many of them who want to be doing hygiene and be scaling, many of them will go on to become a hygienist and go on to a CODA accredited program.
Or become a dentist. Absolutely. 100%.
And this allows them to help the practice be able to manage their patient load and allows them an opportunity for growth for those who want it. Not every dental assistant is going to want this. And not every practice is going to be interested in it.
Right. Well, Paul, I'm going to play devil's advocate with you right now. We're going to run through some of these myths versus facts, right? Some of the things you're probably going to hear. So in that vein, why don't you just expand the dental hygiene programs? So, why do we need to create this whole new thing? This is what you're going to hear from the other side or from people who are not familiar or uneducated about the bill. Why don't you just expand the dental hygiene programs?
Yeah. So the answer to that is this has to be a yes and. If we rely solely on funding that may or may not come from the General Assembly, and we're working very hard to ensure that they understand the stakes at play here in terms of access to care. But even if we receive the funding, we are at a present day shortage of more than 1,000 hygienists and not on a trajectory where we're adding them. So that is a very long-term play to educate and get more folks in that educational pathway. The good news is we know there are a lot of qualified applicants who see the value in those roles and want to be working in those roles. But and what we have heard from our member dentists is we have a demand in my area that I can't fulfill with the workforce that is currently allowed to be doing this.
That's right.
And I want to be doing this. I did not get in this profession to turn patients away.
And those hygiene programs are hampered by so many things, from budget to finding faculty that make half as what they would if they were in the private sector. So that's challenging. Then you have CODA. We're not even going to bring up CODA and the challenges that they bring and hamstring these programs with a absolutely archaic and ridiculous faculty to student ratio that is so overwhelming that it just strangles the ability for these programs to expand. So when you add, and we lobby CODA exclusively, and we've made some ground there, and we've probably been one of the most vocal state dental associations taking on CODA and challenging them. And we've made some headway, but we haven't gotten them to change their faculty to student ratio when it comes to hygiene programs. Right. So funding, faculty, CODA, you name it. But what is not missing is a demand. Right. There is a demand for young people coming out of high school that want to go into hygiene programs, and the need is there, but we can't find them. So this is a solution. Our preventative assistant is a solution to a problem that is right before us right now. It's not something we can wait 8 years for CODA to come around to seeing the light. And so it's very much challenging. Paul, here's something else you may hear. Do dental assistants even want to do this role?
That's a good question. And there are a few things we can look at to answer it. The Virginia Office of Education Economics looks and tracks graduates of programs in Virginia and looks at what were they doing before, what are they doing in their current role. And we know that the most commonly held position before someone becomes a dental hygienist is a dental assistant. Mm-hmm. We also hear from our members that many of them have dental assistants they would love to sponsor and pay for their education to go to a hygiene program, but currently are just waitlisted, unable to get in because there is so much demand for so few seats. I can share an anecdote that I have met several dental assistants who have gone to a formal dental assisting program, not even because they want to become a dental assistant, but because they think that will make them more competitive.
Correct.
As they're applying for a hygiene program. And these hygiene programs are amazing opportunities. More than a third of the students going through them have their full tuition covered because they are eligible for the G3 program that sponsors students for in-demand careers, of which dental hygiene is one of them.
Right.
And the median pre-enrollment income for G3 eligible healthcare students is $23,000 a year.
Yeah.
Whereas you have hygienists who are practicing in Northern Virginia, for example, who are earning $107,000 a year or more. It's an amazing opportunity, but we are constrained right now in how they can pursue that. What this bill does is for those dental assistants who are interested in pursuing a hygiene career, it allows them a pathway within a practice without taking time away from family or away from work to be able to do that and to be able to better serve patients in that practice in the meantime.
This is a could, not a shall, right? So it may not be right for a dental office. That's fine.
Yeah.
It's not right for that dentist or that dental office. That's great.
Yeah.
It may not be appropriate for that dental assistant. That person may not be interested in doing it. That person may not be someone that the dentist is comfortable training to do that. It's still the control of the dentist. The dentist is the captain, the lead, the whatever you want to say, of the dental team. And that legally is still the same. It's the dentist's license that's on the line, whether it's the hygienist that's practicing under that or if it's the dental assistant. And we aim to keep it that way. Now, we have another episode we'll have to do with what the Dental Hygiene Association has planned. We'll save that for another whole episode. But the thing that you will hear from people who are opposed to this, whether it be a dentist or a hygienist, and I'm sure there'll be some dental assistants against it, is this is going to be a risk to public safety. Right. I have a hard time coming to grips that somehow scaling healthy teeth, the non-complex issues, after being trained in the office and being overseen by the dentist and the dentist checking on the work of the dental assistant and that dental hygienist. And the bill also says that you can only have 2 of these preventative assistants in addition to the 4 hygienists that are allowed by law underneath of the purview of a dentist. I have a hard time understanding that argument, that somehow this is going to be a risk to public. I get it. I get why you would say it. I just don't believe it. I mean, at the end of the day, you don't see, this is something that's done in the military, right? At the expanded function dental assistants. And I'm unaware of the mass casualties that have come from the public safety damage that a scaler that I can buy at CVS or Walgreens is doing to the people. It seems a little far-fetched.
And when you talk about risk to the patients, you mentioned the military. Joint Base San Antonio Lackland, where the Air Force oral preventive assistants in training provide cleanings to active duty military members. At that base, they report a dental readiness rate of 97%. That exceeds the Air Force goal of 95%. When you contrast that, the dental readiness of the U.S. Army Reserves in 2010 was 64%, meaning more than a third of the U.S. Army Reserves was deemed non-deployable specifically for dental readiness reasons. Right. When you're talking about the danger to the patient, it's, are we able to get access to dental care in a timely manner? And
the danger is not seeing a dentist.
Decades of experience with assistants appropriately educated, being able to be part of a dental team that allows more patients to get access to care. With the pilot that is currently going on in Missouri, the interim report that came out in July indicated that patients are giving higher marks to the oral preventative assistant who sees them, then to the hygienist and dentist in those practices who are working alongside them. They have been very satisfied with the care they've received. And there is a dentist, as you said, and hygienist coming and finishing the visit so that the patient gets all of the care they need, but that hygienist is getting additional assistance in the care. And you mentioned, yes, you'll hear a lot of noise over the next few months, something that you hear a very different message from the hygienists who are actually working in this modality. And I think something that's important for our members to do is recognize that whatever is being said, whether it's today or over the next few months, we're still going to be working as part of a dental team. Preventative assistants are incorporated into that, and they are really helping other people in the dental team. They are not working independently.
That's right.
They are part of a team that is working together with the goal of providing excellent patient care.
They're not changing the need for a hygienist.
No.
This isn't to replace hygiene. This isn't to take someone's career away from them. That is not the goal here.
In Kansas, they did a performance audit. They've allowed preventive assistance since 1998. They interviewed every single dental hygiene education program in the state. It was about 10 years later after allowing this. Every single one said this has not impacted the ability of our program graduates to find employment as a dental hygienist.
Yeah, and this isn't going to impact that at all. I mean, the need is there, and it's not blowing smoke to say that the idea of all of this is to allow people to practice at the top of their license. So allowing a dental hygienist to remove some of the minutia from their day-to-day to allow them to see more complex cases would also alleviate those cases and those items from having to be done by the dentist, and then free the dentist up to do even more complex things that need to be done. And, you know, I talk to legislators who love dearly our adult dental Medicaid program, which, by the way, is something that we're going to have to monitor very closely. And the funding for that, as we go into this year, there's no shortage of issues in the General Assembly, but the VDA has them covered, right? But if you look at it, there is absolutely a need for this, and we can't walk away from the responsibility we have to the public. On Medicaid, the adult Medicaid, there are some folks who have pre-existing medical conditions that are allowed 3 cleanings a year. Good luck. Good luck finding a dentist, that can see you twice a year, much less 3 cleanings a year. It's just not feasible. We're not there. When you have almost 1,000 hygienists short across the Commonwealth, it's time to do something. And the real issue, you know, I'll be honest, and this cuts to the core. It is hard when the Virginia Dental Hygiene Association is sitting across the table, not even acknowledging that there's a problem. There's not an acknowledgement that there is a shortage. I mean, that makes things difficult. And so this is a very respectful, modest approach. And you're going to hear that it's going to endanger the public and that dentists aren't qualified to train these people, whatever the scare tactics that are going to be used. But we've got enough data out there now that shows this isn't the end of the world, nor is this taking hygiene away, nor is this going to impact and hurt the public. If anything, the whole reason for doing this is to help the public get into a dental office and get their cleanings more regularly. Simple.
That's right.
Right. I mean, I don't know how else to like it. So it can become very frustrating, but we're trying to have these conversations so that our members can hear some of the arguments that are going to be floating around on Facebook, some of the arguments they may hear in their own dental office. The need is on our side, and the time to act is on our side. And we could have asked for a lot more. We haven't, because the VDA has always been very measured, respectful of the hygiene profession and the dental assisting profession, working together as a team. Nobody's looking to disrupt that or to take that away. But let's first off, one, we have a problem. Okay. Let's acknowledge that. Two, I'm unaware of any other solution that anyone else has put out there to solve this. And three, ours is a measured approach that does not have a risk to public safety, is an option for dentists who want it, but does not have to involve it, and simply is trying to deliver healthcare to a larger number of Virginians and be a small cog in solving the access to care problem.
No, that's right. And you can't both believe that dental care and preventive dental care is important and not work to allow people who want to be providing that care a pathway to do that.
Right.
And today in Virginia, we're telling dentists, particularly in rural areas, that you don't have an option, that you're going to have to just tell patients no, because you only have so many hours in the day, and there does not currently exist a pathway.
Yeah. There's no solution waiting to happen. And therefore, that's why we've moved on this. With that, we're going to wrap up. We could talk about this all day. We're going to do another couple episodes. One, we're going to talk about some of the bills that we're going to have to oppose this upcoming session. Also having to monitor budget issues with the adult dental benefit and funding for that. So there is a lot going on. It's going to be an unbelievably busy session. We plan on bringing these updates to you more often. This one maybe wasn't as short as some of the other ones, but you can see why. We'll talk more about myth versus fact, try to empower you to be able to talk about it in a way that is meaningful. You can read about it all you want, but hopefully us just having a discussion here is one that is helpful. But we do need everybody to show up.
That's right.
We need our members to activate, right? So we're trying to engage folks right now. January 15th and 16th is our dental days at the Capitol. The evening of the 15th at the Omni in Richmond, we'll be hosting a reception. We usually get a fair number of members of the General Assembly. They come and have a drink and eat some food and enjoy conversation. It's a great time to lobby, tell them your personal experiences, and just have a great time with your peers. Then the morning of January 16th, the next morning, we will have a bright and early breakfast with a speaker, and then we will head over to the General Assembly for the meetings with you and your legislator taking place over there. We'll have all the talking points for you to take, leave behinds, everything. If you have never come to a dental days at the Capitol, this is your year to come. We already have, I think, registered more than we've had in the past few years have already registered, which is a great sign. We've been encouraging people to bring a friend who's either not engaged VDA member or maybe not even a VDA member at all. This is what we do. This is the reason we exist. This is what the Virginia Dental Association's main goal is. So go ahead, bring a friend. Let us know so we can get them a name badge made and keep track of how much food we need to have. We don't want anybody going hungry at that event. But January 15th,
plenty of crab dip.
Yeah, plenty of crab dip. It's always the biggest hit. The Omni's crab dip is off the charts. But January 15th and 16th, there will be other opportunities to send emails, write your legislator, to make phone calls, to text, sign up for our text alerts, which is also on the VDA website. And we will continue to update you in this manner on the website, on text messaging. We will be covering the ground with fire on this. So with that, thank you, Paul, for joining. Thank you for everything you're doing on the workforce issue. And we will continue to bring you updates. And with that, that wraps up another episode of The Drill.